And back in episode 112, we did an episode. Obviously, the topic was weight loss with diabetes. And we obviously tied in hormones and menopause in there. And there was we got a lot of feedback. And we realized, I think, after we stopped recording, I remember messaging you right after we got done. I was like, you know what? We could have dove into so much more, as we both realized. I mean, this is definitely a hot topic, and there's a lot of other things that we could have touched on. So, and you smartly said, well, let's just do a part two.
Naturally.
Yeah. So that's what we're doing today. So, and these are three areas. And again, we'll probably weave in some other things because that's what naturally happens when we start talking about this whole topic. We're going to focus on GLP-1s, thyroid, so the thyroid gland, which obviously secretes hormones, and then muscle. These are things that we are in tune with, and we know these are questions and things that are happening inside the community, and we hope that this elaboration on this topic of weight loss gives you everything you need.
Yeah, I'm excited. And I think talking about weight loss, there's so many areas to cover. It's almost like peeling an onion. So, and what people need for weight loss is different from one person to the next. So if people are frustrated and struggling with their weight loss, patience is key, but even more so consistency, which I think we echoed in episode 1. But yeah, I'm excited to dive in, cover more ground, and help more people.
Yeah, yeah. And you know, you brought up a good point. This topic speaks to everybody differently, depending on, again, your age, where that frustration you think may be lying. But I think what we try to do is just open all of our eyes to other possibilities that may be contributing to stubborn weight. Our goal here is to not push weight loss. I mean, we're not here, that we should be obsessed with the scale, that our weight defines us. That is not it. We all, as women, we want to reach and feel good in our body, and that's really the goal. And sometimes weight loss is a symptom. We've talked about that a lot here as well. And there might be some other things going on, like you mentioned in episode 112 about our gut health, and obviously insulin resistance, its hormones are dropping. So they're all they're all connected. And again, we hope that this speaks to you. So so we're seeing some women with the type 1 diabetes let's just jump into GLP-1. So if nobody is unfamiliar with these, Kelly, if you can explain, there's name brands out there, and this is a peptide, which is naturally created in the body. It just tends to go low. I'll say go low. It gets to where it's not as effective, how our body's utilizing it. But if you can explain a little bit about the GLP-1s and then the common brands that are typically, some things that we're seeing.
Sure. So GLP-1s, as you mentioned, it's probably familiar to most ears, but it's newer. It's newer in the last 5, 10. It actually came out in early 2000s, believe it or not. I think some celebrities have made it more popularized, and from there, consumers are asking various doctors about this medication. But in type 1 diabetes, it can be utilized, and GLPs are glucagon-like peptides, and they're a group of hormones made in our gut, and it's mostly in response to food. And the most well-known is glucagon-like peptide 1. And there's a few things I wanted to say about this is peptides are of the future. Doctors are now specializing in peptides and beyond these appetite-suppressing peptides. There's other peptides that are helping people heal faster, optimize inflammation, longevity, and they're being utilized in so many different ways. So there's a lot of research coming out on that. I think it's going to be part of many healthcare plans, type 1 diabetes, type 2 diabetes or not. And it's just something that won't be going away anytime soon, to say the least.
Yeah. And the endocrine is quite the system. And you just mentioned it. I mean, I think as type 1 diabetics, we think it's just insulin we have to think and focus on. But no, there's so many other, and we've talked a lot about this too. I've had other guests on here, and we've kind of dove into this topic a little bit. And I think it helps to inform us how the body works. And in our case, what else is not optimal, not just no insulin production, but all these other hormones that work together. We talk about leptin and ghrelin and amylin. Is that another one?
I
Okay.
was just going to say amylin.
Yeah. So again, and those are peptides, hormones, peptides, same
They're
sort of
hormones.
classifications. Okay. Yeah.
Yeah.
So again, our pancreas and that endocrine system it's lacking. And
Yeah.
I think, I think that's our goal is just to kind of educate and inform. And so in this case, in our pancreas, that those hormones just may need a little bit of help. And I think so now we are seeing or hearing more about those with type 1 because this drug is being often prescribed for those with insulin resistance, prediabetes, type 2, stubborn weight, again, all those, medical diagnosis. So what's happening now with those of us in the type 1 space and the availability of it?
Yeah. More and more type 1s are getting access and insurance is covering it, thankfully. And there's actually a push for it to be on label use for type 1 diabetes, but it'll be great
Mm,
once that day comes. However, I might share a little story here. We might learn a little better with
absolutely.
stories. So
Yes, we do
it,
that well. Yes, I love
yeah.
that.
It was about 2017 or 18, and I was a part of an organization here in Ohio for diabetes educators. And I was sitting at this table at a nice dinner, and there was a presentation going on, and I don't remember what that presentation was, but nonetheless, I was sitting at the table with some nurse practitioners, a dietitian, a nurse, and myself as a dietitian, and we all had type 1 for a long time. And as we were eating, the ladies were talking about GLPs, and I was like, GL what? And I
Okay.
was very curious. And again, this is almost 8, 9 years ago.
Okay.
And they're like, yeah, we've been on Victoza or various forms of these glucagon-like peptides that help keep our blood sugars sticky. So when I first heard about it, it was more for blood sugar regulation rather than appetite suppression. And from that dinner, I went to my endocrinologist, talked to her about it, and I've got on it. So I've been on Ozempic, excuse me, actually, I started on Victoza, made my way to Ozempic because my dose was so low,
Okay.
um, since 2018. So
Mm,
this was for a long time. I feel like that's a long time. So I've
yeah.
been on it for a long time. Suddenly Kim Kardashian goes on it and the whole world knows about it. Um,
Yeah.
and it became really hard to get my script. But they've been around longer than we have thought. And the mechanisms and the benefits for type 1 diabetes really go to the core of what we all want. And that's, I say, easier blood sugar, but
Sure.
easier, stabler blood sugar. And
Yeah.
yeah, I think it's just important to plug in that story and kind of share
Yeah.
my
Yeah. I
journey
appreciate that.
on it overall.
Yeah.
But it came with an educated conversation going to my endo and talking through what it is, how I can get approval, and then what to look out for.
So what have you learned along the way? So as far as a woman living with diabetes, so again, you were talking 8 years ago. So you were, if I'm remembering your age right, you were probably mid 30s.
Yeah, yeah,
Okay. And
mid
so you
30s.
were already experiencing some sort of resistance. So this is something which
Well,
was
I don't
your
know if
reason.
I would even say I had insulin resistance. I just my blood sugars were just moving too easily. Like
Okay.
I would say I had more arrows up and more arrows down. And with Ozempic, and of course with proper actions, the blood sugars were just more stable. And a
Okay.
byproduct as well, one of the ladies at that table, she's like, I even noticed an enhancement in my mood. And that's
Mm,
also another huge benefit.
sure.
Um, but I don't know if the word would be insulin resistance. I think it's just the lack of that amylin.
Okay.
Where, I even remember telling the endo at the time, like, I feel like a teenage boy with my appetite.
Mm,
Did I lose weight on it? No. But my appetite did become a little more subtle,
okay.
and my blood sugars became a little more sticky,
Okay. Yeah.
overall. And yeah,
Yeah. And so would you say that you were using less insulin as far as obviously because we know that correlation obviously, and again we're not
yeah,
judging insulin dosage and how much we're taking every day. This is just observation. So
yeah,
going through it and over the years you're noticing that obviously your body's more efficient. This amylin that this
yeah,
peptide is giving you is allowing your body to utilize what you do dose. So in theory you're using less insulin, it sounds like.
yeah,
Yeah.
yeah,
Yeah,
yeah. I would say
interesting.
slightly, and of course, less corrections. less
That's
insulin for
everything.
correction.
That's
Yeah.
everything, isn't it? Yeah, there's
Yeah.
nothing worse than chasing. I know. It's like, gosh, I thought that was enough. Nope, need a little more. Bump it up, bump it up, bump it up.
Yeah.
That's when it get. I think that is the number one thing that I'm seeing. I have a group circle of ladies that are in perimenopause and beyond, and that's it. It's just, it's so unpredictable once the hormones drop. But this is such an interesting part of the puzzle that even in our group, we're not talking about GLP-1s and the peptides as much as we can be. So I'm excited about unpacking this. I continue to learn. And it's funny because I wrote a blog article about this topic probably 2 years ago because I don't remember the doctor's name. I should have had this in front of me before I mentioned it. But that opened my eyes to really the medical necessity and the overall use of this peptide.
Yeah.
And that it's not, if we even think of, hormone replacement therapy, which we're already, pretty much aware of now. When somebody tags HRT as a drug, I don't know, that always kind of sits funny with me because
Yeah.
no, it's something that's already naturally made by the body. So I like that same attachment to what this peptide, it's just filling in that gap. It's filling in what the body is missing. It's
Yeah.
it's really a very similar situation, isn't it?
Yeah. Yeah, definitely. And there's a handful of questions you had asked me I didn't thoroughly answer, but you also
Hmm.
mentioned like certain brands. I already started
Sure.
alluding a brand called Victoza, and I don't hear about Victoza as much with my type 1 clients, but
You're right.
that's a GLP that you take on a daily basis. So that's another injection to take on a
Okay.
daily basis. And then the Wegovy's and Ozempics, which are a little more well known, are a weekly injection.
Okay.
However, an opportunity to share some insight that I've seen with a lot of type 1s and myself too is we aren't taking a mega dose for weight loss typically with type 1 diabetes. We're more microdosing these
Uh-huh.
GLPs
Uh-huh.
to get the benefit of better blood sugars, stickier blood sugars, stabler moods,
Yeah.
better insulin sensitivity, appetite regulation, etc. But I'm finding that a lot of people with type 1 might take a small dose, I'm going to say Monday, and then they'll need even a more micro dose on Friday. So it's a little bit of layering because there's a tail. We know all about tails with our
Sure.
insulin.
Mm-hmm.
And dosing these medications are so unique when someone has type 1 diabetes. I've
Yeah.
also seen women who just dose every 5 days. I've seen people split it in half. I've seen people dose Ozempic, a weekly injection, on a daily basis. So I think it's really important to mention this because not enough type 1s are sharing how much they're taking and how they're taking. And I
Mm-hmm.
think a podcast like this can be helpful to hear that.
Yeah, yeah. And you're pointing out some great things. And I hope whoever's listening, if this is something that they want to maybe pursue with their doctors. So you are seeing your endocrinologist for this hormone. We're not going to call it a medication. You know what I'm saying? This
Yeah.
supplement. Yeah, this thing that you decided to bring in. And
Yeah.
that is a big thing. Just like when we talk about just hormone replacement, is finding a practitioner who knows what they're doing, that
Yeah.
knows you, treats you as an individual, and sounds like you have that type of care with your endo and understands this hormone, understands how it can benefit, or in some cases, even, there are some side effects that could happen.
Yeah.
So it's really that awareness and how it correlates with insulin. So, because I'm assuming that not, again, there's a lot of doctors, there's a lot of medical offices that are prescribing these because, again,
Yeah.
the demand is up. But I think if
Yeah.
that's one thing everybody can walk away with today is do your homework, ask these
Yeah.
questions. You almost need to walk in knowing more than they do, if that's possible.
Yeah.
So yeah, just to go in very, very lightly with it because, uh, you talk about short term. Is this a hormone you plan to be on for?
I foresee being on it longer
Okay.
term. It just has been really helpful. And
Okay.
it's interesting. I'm 41 for viewers that don't know, I'm 41. But I
Mhm.
have noticed like the last year, maybe 2 years, my blood sugars they have taken more energy and it's directly related to these sex hormones. So I have found it as a really good tool in this chapter of my life. Forever, I'm not sure if I'll use it, but again, it's helpful.
Mhm.